Hello, everyone. Welcome. Thank you so much for the introduction, and it's nice to see some familiar faces here. And really, thank you for making the time, everyone, to join us on a Monday morning. So my name is Ola Hamadi. I'm the WWP and Grants Manager. And thanks in large part to funding that we received from the European Union in combination with some of our own funds, we have been able to offer grants to our members for the past 2 years, and we're definitely planning to continue doing that this upcoming year. And in this time, I've been working to support WWPEN members who receive those grants from us, and also working closely with our training and capacity building manager, Sandra Jovanovic, on implementing the first ever pilot of our accreditation system, which is very exciting and which is why we're here today. And I will tell you more about this in a minute. We're meeting today to discuss, as the title suggests, how perpetrator programs can improve and reach their full potential, focusing, of course, on ensuring the safety of survivors. Helping achieve this goal is one of our main missions at WWP, and to that end, we have recently published our European standards for perpetrator programs, and to further support organizations, we are now developing this accreditation system that we will be talking about. So for the next just under 1.5 hours now, this is the plan. I will give you first a really brief introduction to the European standards and the accreditation itself. This is kind of just to give you a little bit of context, just so you know what we're talking about. I can't go into detail, unfortunately, right now, because then we will move on to the main event, which is a panel discussion with some of the people who took part in this year's first pilot of this accreditation. We will meet two of the organizations that underwent the process of assessment, and two of the assessors who evaluated their work and who supported them throughout the year. They will share their experiences and thoughts on what it was like to participate in this process. And then we will move on, as Dura mentioned already, to a Q&A session where you will be able to ask all your questions for them or for me. So please note them down throughout as they come up. So just first, as a word of introduction, as I also know there are some new colleagues joining us today, let me say that WWPEN is a European network organization with members who are mostly, of course, perpetrator programs. We also have women's support services. We have researchers and other organizations in the field of domestic violence prevention. And our mission is, as you can see here, to address violence in close relationship as a gender-based phenomenon, foster gender equality, and improve survivor safety through the promotion of working with perpetrators of violence. Okay, so just for a brief introduction, before we start with our panel, as I already mentioned, last year we published our European standards for perpetrator programs. And just to set the tone, the scope of this document is very specific. So it describes minimum standards for programs for men who use intimate partner violence against their their female partners. Of course, we know that many organizations run other types of programs as well. However, these standards are not meant for other types of interventions. So we're really focusing here on male perpetrators of intimate partner violence specifically. It was crucial for us in developing this document that it is based in research and scientific evidence. But that it is also really fundamentally based in the experience of practitioners, and that it's useful for practitioners. So we very often hear from our members who work with perpetrators that there is a need for guidance and for support, and that this is really work. And I also know from my own experience of working with perpetrators that it's work that can feel isolating. It can be really stressful, and sometimes it's difficult to know if you're going in the right direction. So this document with standards is meant to do just that, to support you and your program in delivering as safe and effective of an intervention as possible. So as you can see here on this beautiful tree, these standards are rooted in research and mappings of current practices, which we have conducted extensive mappings throughout Europe, other available international guidelines, and also in insights of practitioners. We had really extensive consultations with people from all corners of the field, and the standards are meant to ensure programs are safe, that they're effective, that they're accountable for the work that they're doing, but maybe most importantly, that they are survivor-centered and really take into account the perspective of the survivor, because this is the real goal of all of our work, is to make sure that women and children are safer. And you'll see hopefully that throughout this document, but also throughout all of our work, this is really the lens that we use to look at perpetrator work, is whether what we're doing is making the survivor safer and feel safer and be safer. And to this end, the standards themselves describe safe practices for perpetrator programs in these 5 areas. So they focus really heavily on the safety and well-being of survivors and how to ensure that in your program, on assessing and managing risks throughout the program and with a follow-up after, on program design and delivery. So what should be the actual structure of the program and the groups that you're addressing. It also looks at quality assurance and evaluation practices, as well as the management of the organization itself. And I unfortunately do not have time to go into much detail. Some of you were even involved in the creation of the standards. Some of you have had a chance to read them. If not, I will ask Dura to put in the chat the complete document so you can take a look and review it. And I'm very proud to say that due to the efforts of some of our grantees in this last year, it's now available in several languages, and we will have more coming soon. We know it's really important for accessibility as well, and for using in local contexts, that we have as many languages as possible available. So the most important message, without going into detail, that I would like to kind of leave you with around the standards is that they are really meant as a safety net. So we do not want to create a document that will kind of become a bureaucratic burden on organizations that we know are already very often over capacity. This is meant to create an environment where you kind of know what, even if things get stressful, if they get too much, you're really busy with your work, you know that you're heading the right way. And we, with this safety net, want to help you work well and improve your practice, but also to empower facilitators and make sure that they feel safe in the work that they're doing day to day. They're also a helpful tool to make change happen. So I know most organizations already have a lot of advocacy efforts going on, and we have heard from places around Europe that it's been really helpful in this first year already to use the European standards as an advocacy tool on a local and national level. So you can show here, this is the European standard, so we should be improving things in our own context as well. And it's also a tool to advocate for sustainable long-term funding that's necessary to provide safe interventions, and that's also part of the standards. And that's a very brief introduction. And now to say a few words about the accreditation, because building on these standards, we're now undertaking a new and very exciting challenge of developing a system for a European accreditation for perpetrator programs. So to put it very simply, this will be a process for which programs will be assessed on how well they comply with the standards, and crucially for us, supported in improving the areas of their work that they still need to improve. Those who achieve the required threshold will be able to be accredited, and that will be an opportunity not only to improve your work and your practice, but also to showcase the work that your program is already doing. And for those who become accredited, of course, to demonstrate the really high level of their work. As I mentioned, this is something we're still developing, and this year we have the opportunity to pilot the assessment process with the first 4 organizations, and these were four of our grantees this year who went through this initial assessment process for a future accreditation. We also worked with 4 amazing assessors who are experts in the field and who were assigned to these organizations and worked with them throughout the year to support them and to see their program in depth. Just to outline what the process was like for them and what it will be like in the future for more organizations who apply for our accreditation. What happens is that organizations get assigned an expert in perpetrator work, or in this case, this first year, they even had 2 experts each who get to know the program, the team, and the organization. There is also a site visit, so a few days where the expert can get to know you, the context you're working in, really kind of get into the practice, because it's always difficult to show everything online. It's really important to us that someone goes and actually sees what's happening on the ground. Then you receive a detailed report on good practices and also, of course, on the areas that are still needing some improvement. And together you can make a plan on how to move forward. So you will really receive really specific guidelines and tips on how to move forward that are suited to your context and take into account all of the local idiosyncrasies. We also know that the legal situation is different in different places. So it will really take into account all of those considerations. I want to say on a more personal note that I had the pleasure to be there throughout the year and see this process develop and see those 4 organizations go through the assessment. And I'm really happy to say that once again, we're focusing not on creating a bureaucratic procedure, which I know when I say accreditation, it can kind of read immediately like that, but it's really becoming a chance to take a step back, to take a look at the work that you're doing with an experienced professional who will help you to grow. For now, just I want to say that this is right now only open to our members through the grants that we offer, as we are still really testing it and learning what the best way will be to do this accreditation. And we will in the future be expanding and opening up to other projects as well. And we are planning right now to launch the full accreditation system around 2026. Okay, so now I will stop sharing my screen and so I can see everyone. And I'm very excited to introduce our panelists for today. So we have 2 of our accreditation assessors with us, Dean Adjukovic. Dean is a professor of psychology at the Department of Psychology of the University of Zagreb in Croatia. Over the past 18 years, he has led the development of Croatia's first perpetrator program, provided individual and group treatment to perpetrators and victims, and helped design the training program for providers who work with perpetrators, and train many professionals, of course. Hi, Dean.
Hello, good morning, everyone.
We also have Rory McRae with us, whose background is in criminal justice and social work. And starting in 1991, he worked with the Domestic Violence Probation Project in Edinburgh, where he was the co-developer of the men's program. Rory was one of the authors of the practice manuals for the Caledonian system, which is the accredited system across Scotland. Hi, Rory.
Hi there. Hi, everybody.
Okay. And now we have also the representatives of 2 of the organizations that underwent the assessment this year. So we have Svetla Spicheva and Nina Nikolova from NAIA in Targoviste in Bulgaria. NAIA was established in 2002 as one of the first civil organizations working on gender equality and women's rights in Bulgaria. And they run a perpetrator program in Targoviste. Hi, Nina. Hi, Svetla.
Hello. Hi. Good morning. Nice to meet you.
And we have Uroš Gradišar with us from the Association of for Nonviolent Communication in Ljubljana in Slovenia. The NK is an organization that was founded in 1996 as the first NGO in Slovenia with programs for victims of violence as well as perpetrators of violence. And Uroš manages the Perpetrator program. Hi, Uroš. Okay. So let me start without further ado with our first questions to the panel. So first to Naya. Please tell us what motivated you to participate in pursuing the European accreditation.
Back in 2014, when we decided to start our Perpetrator program, after had been already supporting victims for 8 years, we were guided by the theoretical frameworks and practices described in the WWP's Guide for Developing Standards for Programs Working with Male Perpetrators of Domestic Violence. After that, we participated in the discussions of the European Standards draft for work with perpetrators. We wanted our experience and our practices as well as of our Bulgarian colleagues to be taken in consideration. We also wanted our vision and our ideas for the highest quality of work with perpetrators, also our national context and legislation to be reflected in the standards. To be part of the piloting of this pursuit of the European accreditation was our great desire to see and to understand to what extent we have come close to and cover the European standards. We wanted also to know if we have aligned to the standards, what we are missing, what we need to change, or what we need to add in our interventions with perpetrators, so to be more effective in our support of victims.
Maybe I can add that NAIA has never stopped developing its perpetrator program, focusing on different areas. For example, child protection, multi-agency collaboration, protocols for coordinated support between victim support service and perpetrator program. But our motivation for pursuing accreditation was to bring all of these areas together and to test how well we are applying in all this area gender sensitive and survivor focused approach in working with perpetrators. Accreditation also means prestige, of course, and it's also motivation for us because it is important for us to demonstrate to the referring institutions, to the public authorities and to the local community that we provide sustainable and also focus on the victim safety approach in working with perpetrators. And last but not least, we are sure that after accreditation, we will be able to present and to communicate with the donators much better than now.
Thank you so much. So really interesting points on that it kind of brings the entire practice together. I know Naya before was taking part in different projects around the ASAP protocols for collaboration and child protection, and now this was a chance to kind of bring everything together and look at it holistically. And Uroš, the same question for you. What was the motivation of the NK to go through this accreditation assessment process?
Yes. Well, we are running this program for perpetrators since our beginnings. In 2004, we started with the groups, and the program we were developing programs slowly till today. And today we really have a lot of perpetrators, and we are overwhelmed with all work. So we decided to stop and to see what we are doing from where we started, to deconstruct our practice and to make some improvements where we were aware of shortcomings that we have. We were we were facing all the challenges that we have with institutions, and we felt quite alone. So we decided to join this project to get support from something what is above us. We are aware that just these perpetrator programs are not enough if it's not connected with services for supporting victims. So this was the main motivation. So we wanted also to sit down and to discuss also inside the team. It was really important for us. To make some self-evaluation. We can be really critical to what is happening in the society. So this was a challenge to be critical toward ourselves. That was the main motivation, to stop and to reflect and to improve. And also how to improve. Tips.
Thank you, Uroš. That's really interesting to hear about kind of also a reflective process inside the organization. I had the pleasure to join one of our assessors on the visit to DNK, so I can also say that it's a big team, and I know it required a lot of internal work and internal communication from you to reflect on your practice. And now I have a similar question to our assessors. So Dean, maybe you can share first, what was your motivation to become an assessor and to take part in this process?
Yeah, well, first of all, I think it was a kind of a logical step for me to respond to the invitation to become one of the assessors because of my long-standing involvement with the WWP as one of the founding members, or our organization as a founding member. And then through our own work here in Croatia, that we have to meet a number of obstacles and challenges. And so I felt that this would be going two ways. One is a learning experience for me, how the organizations that are attempting to become accredited are working around this probably similar barriers and issues and challenges. And also to offer some of our experiences that may have been similar to the organizations that were being assessed. And that worked fine for me. I was involved as an assessor in 3 organizations. I could also see a lot of similarities in our common work, and also that extends across other organizations throughout Europe. But then also I saw the things that the organizations are facing, and these are the limitations that they have. And we can talk a little bit later about that. But in any case, I was very excited also that WWP is moving forward with the implementation of the standards. And I, together with Alessandra Pauns, I was the co-author of the first guidance to develop the standards in 2018, I think. So you can see things developing, and that was something that I was so eager to see how the things are going forward. So that was my motivation.
Thank you so much. Yes, definitely. This is the next step in a long line of steps that WWP has been taking for many years to get to this point where we can actually implement standards in practice. Rory, same question to you. What was your motivation to become an assessor?
Similar to Dean, I think, really. I've been working in Perpetrator programs since 1990, so a long, long time. And last year, I stepped back from my operational role in the Caledonian system. But I still feel really passionate about the work, and this was a lovely, well, involvement generally with WWP has been great for me. It's been relatively recent that I've been actively involved in WWP, but the whole experience of meeting passionate and committed workers from all over Europe with shared goals and shared values, but working in very different legal contexts or in terms of resources, in terms of political contexts. And I suppose so that's been great generally, meeting other projects. But I suppose specifically the idea of being involved as an assessor in accreditation is I suppose it's trying to bring into practice this belief that we all have, that despite these very different contexts that we're all working in, and different challenges that we're all facing, we share a set of principles and an approach and a set of values that can apply across all of these. We believe can apply across all of these different systems. So to have the opportunity to work closely with two organisations to check out, can this work, this universal set of principles in these very different contexts, but to see how people can do that, and also to learn from other projects. But yeah, over 34 years in Scotland, we faced a lot of challenges, a lot of obstacles, and we've worked to a stage in Scotland where it's not perfect and we still have to learn, but where I think some of the challenges that we've met and some of the learning that we've taken from the challenges that we've met could be useful to other projects as well.
Yes, thank you. So kind of from both of you, what I'm getting is that it was a chance to also see what is similar, what is different. There's a lot of similarities. We know the same challenges or similar challenges faced by programs around Europe. There is also some very local specific contexts, and as you were both kind of sharing, this is really interesting to see what are the specifics of that and how can we apply a common framework to all of these very different countries and very different levels of implementation, because we also know that across Europe for legal, political reasons, for many different reasons, we have, you know, some practices that are very, very advanced in some places where it's perpetrator programs are still kind of in the developing stages. And maybe we can explore all these thoughts a little bit more. So my next question is first for the grantees around kind of what the impact of this process has been on you. Maybe we can start with you, Uroš, this time. I'm curious from your perspective, what were the benefits of taking part in this process for the organization as a whole, for the team, but also maybe for the clients going forward?
Yeah, we remember what motivated us when we started with this program. So we started this program for perpetrators of domestic violence. And through time, we slowly expand this area. So we start to accept also other perpetrators, sexual offenders, we went back. So first thing what we made, we write down a new eligibility criteria, which was quite relaxing for us. Yeah. So this was really an important impact for us. So we go back a little bit. It was not an easy process. But what we get also was insight from outside. Yeah. So someone who is from outside give us feedback of what we are doing. We met people who are sharing values. This is also really important for us because here in Slovenia, we are the only organization who is working with perpetrators. And yeah, to get this feeling that you are not alone is really important. Yeah, we wrote new protocols. We find out what we already did. We haven't written down what we did, but this helped us to write down. Yeah, and what we do now, we started with this impact evaluation toolkit. Yeah, which help us to be more proactive with in this partner contact. Yeah. So in this short time, I would say that was quite a lot. And also one new consolidation within a team. Yeah, this is a huge work for us also. Yeah, I would say that this was the main impact for now.
Well,
Yeah.
I think for 1 year that sounds like a big shift.
Yeah.
Thank you for sharing. And Naya, Svetla, and Nina, what's your perspective on this? What do you think for your team and organization has been the benefit or the change that you've seen?
Our experience is the same. The benefits are many for us. First, we took the time to do a comprehensive review of our program. All procedures, forms, protocols, clients' files, all documentation that accompanies the implementation of the program. We reviewed our all 24 sessions for work with perpetrators as topics and tasks, and rewrote them with clearly stated goals, approaches, tools, activities, and expected results. This is available for us because we should have done this earlier, perhaps. It is unavailable because in order for this comprehensive review to happen, we had a lot of conversations and discussions within the team regarding the major goals of the program. If these goals have been achieved, how we understand that the program has been effective, etc. This brought us to the beginning of the program, and we remember why we developed it. We remember this specific energy that accompanies every new starting, and we recharge ourselves with this energy again. Also, we remember the difficulties and the things that didn't happen, but we also realized how much we had achieved. We saw that there are many practices that are in the line in the high standards for work with clients, but we didn't have written procedures or we didn't have rules for them, or we didn't have enough evidence for them. As I think it is with each of you, I think so. We remember the people and the institutions and the circumstances that help us to start it and being helping us in these 10 years. And despite the many arguments, many debates and discussions in the team, which were sometimes quite difficult, we really inspired again. Regarding our program, we have added 3 new sessions in the intake phase, and we added 2 new sessions in the follow-up phase. The sessions in the intake phase will allow for a more precise and detailed assessment of the perpetrator's suitability for the program, because until then we have worked with all clients that referred by the court, with the clear understanding that when a perpetrator has some addiction or some mental illness or total refusal to cooperate, the program can't produce results. Another benefit for the program is that we will conduct the risk assessment not only at the beginning of the program as before, but also in the middle, at the end of the program, and in the follow-up phase, as well as in extraordinary circumstances surrounding the perpetrators, such as loss of a job or loved ones, a moving city, etc. As I said, we were introducing a follow-up session, a phase of 2 sessions, and in this way, it will be possible to track how the risk assessment for victims will change, and how the perpetrator's behavior will change in terms of not committing violence in intimate relationships with women. Regarding our service for support of victims, we have added and scheduled specific sessions for consultants. We will conduct with victims for present the program in detail, to identify victims' expectations for the result of this program, which are sometimes quite unrealistic and can pose additional risk for victims. We also realized that we didn't identify all potential victims around a case, including we didn't identify all children that affected by violence or maybe affected by violence, and we changed this so that in this way we can cover everyone directly or indirectly affected by violence in a case.
Maybe I can add to this that I think we have one big benefit for our team of frontline professionals, because you know that when we work on domestic violence cases, it can bring worry and stress to the consultants, because in most of cases they are very serious risks, and all the new practices that Svetla described and that we have introduced in our program for ongoing risk assessment, exchanging of information between case managers and joint planning, make our concept of risk assessment and management more clear. And after the pilot accreditation process, I think our consultants are more confident in their work with perpetrators and with victims.
Thank you so much to all 3 of you for sharing. I think there was a lot of really important points and really specific changes that you mentioned around evaluation in DNA, around the risk assessment and follow-up, and many, many other parts of your programs that you have been shifting, I know, throughout the year. As I said, there's a lot of work that happened this year. But something that I would like to pick up on that seems to have come up for both of your organizations is kind of a chance to, it seems like it was a chance to get back to the why of the work, and to really take a step back. And sometimes if you rush, you have so much to do, you forget why we're all doing this. And it seems like it was a chance to really remember what was the goal and the point of all this work that we're doing, which hopefully is also bringing a new energy to the work. And I have a similar question again now for our assessors. I wonder, from your perspective, Rory, what's the benefit for organizations in taking part of this assessment, but also maybe what's the benefit for you as an assessor? What did you take away?
Okay. So I think everyone has highlighted, I think that asking about why we're doing this work. For me, for the organization, for the organizations, I like to think it is the process allows you to focus your mind and ask yourself the questions that you should be asking about your practice. It gives a focus to those questions, and we should all be constantly questioning our practice. And I think that this framework allows you to focus on what questions you should be asking yourself. And it's an opportunity to step back. And as Svetla and Nina said, it's building on good practice, but it's looking at where practice might not be consistent, or where there aren't the written processes or the documentation. And it is very much not about bureaucracy, but equally having that opportunity to ensure that that practice is consistent, and that good practice, where it happens, doesn't just happen. It happens because there are structures and documentation that require it to happen. So that level of documentation is really helpful to individual practitioners. It's not bureaucratic. So I think for the organisation it does that, and I think as Nina says, the idea of for the organisation of giving of firming up their reputation, of giving them weight potentially in negotiations with funders, and having that status, I suppose, I think is really important. And I think for the team, I hope that what it's done for the teams is provide affirmation of the work that they've been doing, and I think an appreciation of each other's roles within the team. I think actually focusing on what your colleagues do is actually a really good. This is a good opportunity to do that, and but for the teams, it's and for workers on the ground, it's giving feedback. It's giving helpful criticism. And I think for clients, I mean, if practice improves, then clients' lives improves. It's as simple as that. And I think our clients have the right to expect of us a professional service, and I think this process will ensure that we are providing the most professional service that they can. And I think that's the least our clients should expect of us, because we're asking these men and their partners, in fact, but we're asking these men to do really difficult work, and they deserve a good service. And I think this process can ensure that can happen. And I mean, for me, it's just I particularly the visit. I really loved visiting Targovista and meeting a team and meeting a team of people, and having read lots of documentation about the project. The visit kind of brought that documentation to life. Seeing the kind of the social interactions in the team. I went dancing the team, and I said one of the things I was going to recommend for all projects is that the team should dance together. So I don't know if that's actually going to happen, but anyway, that was so for me. It was a real pleasure. It gave me more than I expected from. I mean, in terms of enjoyment, and in terms of kind of reinvigorating me. I don't think I needed that much reinvigoration, but learning from this group of practitioners was really helpful for me on a personal level too.
Thank you so much. Really, really good different thoughts and outcomes, and also important point on the recommendation of dancing for everyone in teams and otherwise, hopefully. Dean, what's your perspective on this, on the benefits for the organizations and also maybe for yourself?
Yes. I don't really have very much to add to what was already said. I think we concur on the things that were, from our view or my view, were beneficial for the organizations. And that is having somebody who is friendly and critical look at the work of the organization on the practices. as it was already said, we get so much involved in what we do that sometimes we just don't have the overall perspective of the work, of the contents. We are much more aware of the volume of the work. And I think that was helpful for the organizations that I have assessed, and especially the two that I had the privilege of doing the field visit. Basically, I think what could have been beneficial for the organizations is the awareness that there is the need to not only think but also document of what is being done and how is it done and why is it done. Ola, you had mentioned in your introduction several times the bureaucracy, and that we don't want to burden the organizations with bureaucracy. But I think it became quite obvious for the organizations that documenting the things like what they do and how they do it and why they do it is important for several things. One is, of course, the retrospective, the review after some time, where we were, what we do, and learn from our own process. The other thing is something that was mentioned by one of the organizations is the transfer of common knowledge and practice for the new members of the team who are onboarded, so that they can have, look into whether you call it a handbook or documentation or whatever, what are the procedures and why you do that. We know that quite often we do the onboarding informally, so people learn by seeing or job shadowing, which is an excellent thing, but still having that the common historical knowledge put together is very helpful for the new members. And third thing, I think it's helpful, and we had some discussions about that, is that when we document what we do and why do we do it, is kind of safeguarding that we do not only the good things or implement the best practices, but also should there be the escalation of violence, even leading to femicide, if you will, and we are involved with the perpetrators, then the authorities and the public will turn to us as well and say, what have you done to prevent? Have you been doing the best of the best not to do that? And I think that is important for the organization and for the facilitators, also to be able to document that whatever we have done is in line with the best practices and knowledge. So that's my view, what were the greatest benefits. And then the next thing is that they have, as it was said already, to identify some of the gaps or areas of improvement. And it seems to me that a common issue is the development of the partner contact and referrals to partner services and developing that kind of collaboration. The other one is improving and standardizing the risk assessment, dynamic as well as static. And I think there is, from my experience, there's space for improvement of that in all the organizations that I visited, but also in others that I know of and in my own as well. So these are probably the two areas which I think will be the most beneficial from the critical discussions that we had. But I hope that this was also seen as a friendly critical discussion.
Thank you. I think Both of you had a lot of similar points, and I want to pick up on one being the and I think also this came through in what Svetla, you were saying, that taking stock of the practice and documenting it is really, really important for safety, for accountability. But also, and I think this has been the experience of a few organizations, sometimes it shows that you're doing more than you think you're doing. You maybe you don't have a procedure, but you are doing it, and then you can put it in writing and make it a procedure to pass it on to the new employees. But I think a few of the organizations have had the experience that they learned about gaps to improve, but I've also really enjoyed seeing people go, huh, we're doing some really good work in some of these areas. We're really doing it along the standards. So that's also something that I think came out of these evaluations. For the next question, I want to ask all of you a little bit about what the assessment process itself was like for you. And just to flip it around, maybe let's start with the assessors. Rory, if you could share what was important for you when you were doing the assessment, and how did you feel throughout the process?
Okay. So, I mean, the process worked well. We had a series of online meetings with the two assessors and the projects. The paperwork that was available, I mean, the process that's been designed by WWP worked well. In terms of using the accreditation application form almost as an initial checklist so that you could start to take stock of where you were going to have to do some sometimes quite significant work to get you to the point where you're accreditable. So that process worked well. Seeing the documentation gave me a reasonable sense of where the organisation was, but then the face-to-face visit, as I said, kind of brought it alive in a way that just reading the documentation can't do. And in terms of what as an assessor I appreciated from the organisations was an openness, a willingness to be self-critical, an openness to reflecting on practice. And it occurs to me that when we think about our ideal male client, it's exactly the same thing that we want. We want openness, ability to be self-critical, and kind of a readiness to reflect on practice. And so having that approach to the accreditation process from the organisation made it a much more enjoyable experience apart from anything else, but I think also a much more constructive experience. This shouldn't be this, because the standards are quite hard to achieve, and we know that. I would hate people to kind of become defensive about it, and we all work. We all work to the best of our abilities and to the best of the situations that we're working in. And potentially, if this process became like an audit process where you're ticking off whether you're achieving certain standards, it would have literally the opposite effect of what we want it to have, which is to encourage and to improve on good practice. So I think, I think the pilot's been really useful, and I think it's clear what organisations can get from it and what we as assessors would want from organisations to make it the most productive process for everyone. And I think we've done some learning about tweaks to to the standards themselves. And that's going to be an ongoing process, but certainly tweaks to the accreditation process, and I'm looking forward to that those discussions within the assessors group to see how we take that forward. And I'm just really grateful to the projects for opening themselves up to this and allowing us kind of to learn from their approach to it.
Yes, thank you, Rory. I agree that there was huge openness from all of our pilots to share their experience and to really be honest about the work and open about what the challenges are as well. And of course, as Rory already just hinted, but I just want to underline that for everyone, that both the standards are a working document, so we're expecting to periodically update it, and this accreditation is very much an ongoing learning process that we will be adjusting. Dean, how about you? What was your experience of the assessment process itself, and how did you feel?
Well, my feelings and appreciation were very similar to what Rory has said already. At times, I felt that the burden put on the organizations to prepare for the accreditations was huge. But probably one reason is that it is demanding. I mean, there are 87 indicators that we were jointly looking at, and that's a huge work. If it was even ideally prepared and if all the documentation was in perfect condition, that would be a lot of burden for the organizations, along with their own ongoing work. The other thing is that some of these documents were not really easy to comprehend, because there is much more behind it than it is written in them. And what we were looking as assessors for is, where is the evidence that will show that these indicators are met or fulfilled? And sometimes it was unclear, but we had, as Rory said, a number of online meetings, and also the in-person field visit was enormously beneficial. Also to not only to meet our colleagues, but also to feel the atmosphere. And there was, in my experience, there is always so much positive energy and atmosphere in all the organizations that I have, both organizations that I have visited, but also during the online meetings as well. A lot of enthusiasm, a lot of really keen determination to make things work and better. During these meetings, I felt sometimes uncomfortable a little bit, because I had to kind of probe into where the information is, and it was not forthcoming easily. Not because people didn't want to talk about it, but because it was not readily available. So that was a little bit uncomfortable for me as an assessor, yeah, and of course it was great to feel being welcomed. And the organizations were open and ready for critical reflection. In some cases, they have asked for our own experience and kind of, I wouldn't say guidance, but kind of reflect on how things could be done on their behalf. And it was nice to see that some of this sharing was implemented later, very shortly after the assessment. And one thing that I feel that would be better if the timing was different. I know from the WWP side that it's not easy, but to do the assessment during the summer vacation period is not really efficient. both for the assessors and the organizations, and people just need to, have their lives in addition to being accredited. This is something that we need to consider. I don't have I know what the limitations are, what the restrictions are, but still, I think that is something that was not beneficial for.
Mm-hmm. Okay, thank you both for sharing, and for sharing. Definitely, there are some improvements to be made in the process, and yeah, I mean, it's definitely work to get the documentation ready. I agree that all the organizations really put in their best effort to get ready for the assessments and to make sure that it's possible. It's also been an interesting challenge, I think, from my observation, because we're talking about so many different languages. We're all speaking English here, but actually very few of us have it as our first language. And so there is a lot of translations going on, and we have to make sure that things don't get lost in it as well, which has been interesting. But good to hear that you also saw a lot of positive energy and and I also definitely can say from my side that going on one of the visits gave even me a lot of new energy for my work. It really, I think, brings home how hard people are working on the ground, and it's so nice to just see the teams coming together and really thinking about their practice and really engaging in this process, even though they're already busy with all their daily tasks.
Yeah. Oh, I just want to add one sentence I forgot. Rory has mentioned the usefulness of the initial application with a kind of self checklist.
Mm-hmm.
This was extremely helpful for us, but I think, and it was very clear, I would say, as a document itself, but I think we need to provide more background information and kind of guidance how to complete it,
Mm-hmm.
because it may look bureaucratic, but actually this is where the information that we need to look at is hidden. And that helps very much the assessors to kind of be guided through the document or place in the document where this is referred to as being fulfilled or not fulfilled or whatever. That took us a lot of time, digging through the documentation without being really guided through where this specific thing is.
Mm-hmm. Mm-hmm. Okay. That's an important point. So for everyone else to also know who wasn't part of the process, it starts with a application, which is going through all the current practices of the organization around each of the standards and where they're documented and where they're enshrined in the protocols. Okay, and now I'm going to give the same question and I will invite you, Uroš, to tell us a little bit about what the process of the assessment was like for your organization. How did you prepare, and how did you feel, you and your team, of course?
Well, it was time consuming. Really a lot of work. I would say demanding process. But that's what we needed, I guess. Yeah, it took us really a lot of time to collect all that we wrote down in our past, to revisit all the documentation, protocols, for all meetings inside the organization. So this visit of the assessor was actually the best part of the process. So, and also these meetings via Zoom that we had were also good, but this visit of the assessor was really good. Yeah, it's true that some questions were I would say uncomfortable. Yeah, but it's good that they put such questions that made us think and to reflect on our practice. Yeah, Yeah, we had really a lot of work. And it's short time. It's short time. There is really short time to do everything, to make meetings, visit, all the documentation. Besides other work, it's really short time. So yeah, but we wanted to do this, so it's a valuable. Yeah, it's really valuable process for us.
Yes, so it took some time, hopefully worth it in the end. I acknowledge fully also, just for everyone else, that right now we have a short timeline. So these 4 first organizations undertook this whole assessment process in the span of 6-7 months, really 6. And that's because of how our funding from the EU is structured right now for the grants. But hopefully something we can revisit in the future, because we realize this is a short window. And now Svetla and Nina, maybe you could share a little bit from your perspective, what was the process of assessment like for you?
Yeah. At first, we were worried about the evaluation. We did not know what to expect from our evaluators and from the whole process. Will the evaluator be very critical to our work? Will they take into account our specific, or will they strictly adhere to European standards? Will be to explain clearly what we are doing? Will we be respected? As soon we had a lot of questions and a lot of concerns at the beginning of this process. As soon as our first meeting with our evaluators, Rory and Fiona, we met some very positive and well-intentioned people with a sense of humor, exceptional experts, and with great interest in and respect for our work, and very supportive. Thank you. The whole process was very intense, with many tasks, conversations, and discussions. Some of them not very easy and pleasant, but for me and for us, absolutely necessary, useful, and professional. There is no growth without pain. This is my value. The first meetings with our accessors were to introduce them to our history of the organizations, our programs, our national context, and we defined the framework for our joint work. In this phase, we realized that we were on the same page, that we had common values and understandings and mutual respect and esteem. A lot of work followed on the documents describing our practices and the relevant evidence for them in a special accreditation application form. This part of the process was quite tedious, but without this, it was not possible for us and for any external expert to realize exactly what we were doing, how we were doing it, where our achievements were, where our shortcomings were, and what we need to improve. The feelings in the team were diverse. Some liked it a lot, Nina. Others found it pointless, and others were philosophical. Me. If it had to be done, let it be done. A 2-day visited place followed, which was unforgettable for us in every way. Discussing, debating, arguing, and sharing theses, opinions, and concepts with such erudite and experienced expert as Rory McRae was a truly incredible experience and learning experience for all of us. Thank you very much, Rory. In addition, as Rory said, we had a lot of pleasant moments and we had a lot of fun. During the piloting process, we had a mentor, Chris Newman, who is also an exceptional expert in working with perpetrators of domestic violence, very positive and open to sharing experience and expertise from his work. He helped us a lot of materials about the issues risk assessment and also provide us, as I said, materials. Various tools, checklists, and materials also were provided to us by both Fionnuala and Rory, for which we are extremely grateful. The process ended with a report on our readiness for accreditation, our compliance with European standards, and recommendations for improving our procedures and practices in the program. From the 12 areas of the 5 standards for working with perpetrators of domestic violence, we met 47 and met 5 partially. We sincerely hope to have the chance to be assisted in fully covering of the standards by these 3 experts and by the European network team next years. Thank you. Thank you very much.
Thank you, Svetla. Nina, would you like to add something as well?
I can add 2 or 3 sentences from my personal experience, because as Svetla said, at the beginning I was focused on the documents, and main questions for me was how to present our organization and our practices in perpetrator work in the best way in front of the assessors and network. But turning point for me was when Svetla started organizing a lot of internal meetings between administrative staff, practitioners, and we discuss, and I realized that the main questions, how to present organization, is wrong. Because this accreditation process is not from someone that is outside our organization. This accreditation process is for our organizations and for our clients. And it is really a chance for us to improve our capacity, to improve our practices, and added value is the meeting with such experts like Rory, Fionnuala, and Chris.
Thank you so much. I am glad to hear that you also had so many positive outcomes. Of course, some of the conversations must not have been that comfortable, but I agree with Svetla that sometimes that's necessary. And I want to say, this is something you mentioned just now, Svetla, but also just for everyone who might be thinking about this in the future to know as well, that we definitely understand that this is work, and that not just the process, but actually adhering to the standards is a big ask for many organizations, and they will need a lot of support. So this is our way, the accreditation is our way of putting the standards into practice, but we're also really working hard on making sure we have the tools to support organizations practically with mentoring, training, grants, with funding. That's what our grants are for, therefore improving your practices. And I know that's something that often gets overlooked in funding. So we're really trying to offer money to do these things that some funders might think are extra, but we actually know that they're necessary for the safety of our programs. We're a little bit over time, so for the last question, I'm going to ask you all to keep it brief, and I will mix the order up a little bit, because that's the same question for all 5 of you. So how probable is it that you would recommend this process to other organizations? From maybe you can give me a number from 1 to 10, and why, and what would be your main advice for them? Dean, let us start off with you.
I would very, very much advise or recommend the organizations to apply for this when they feel ready. With this experience, and I think that should be available on the WWP web page, a summary of the experiences. So when they are ready, they should apply. They should be aware of what was said here today by Svetlana, that there is a lot of work, but there is so many benefits. So I would say, yes, apply when you are ready, and give on the scale, I would say 10.
Great. Uros, how about you? What would be your recommendation and advice?
Yeah, I would also say 10. I mean, if you are working this work, then I would say for sure 10, because it's really important. Yeah, it's really important. It's helpful. It's really helpful, supportive, and it's, well, I think that we all need this. We all need to someone with who we can talk and who can help us to improve our practice from outside, and who share our values also. So I would say 10, although it is difficult. Yeah.
Okay, great. Nina and Svetla, what's your perspective on this?
10 from 10. I recommend other organizations to apply in any case, because everything that will happen will be very useful and interesting for them, and will contribute to becoming better professionals with better quality programs. My advice to other organizations is to be calm and open to new challenges, and wish them to have a lot of pleasant and funny moments in their future pursuit of accreditation.
Okay, thank you. And sorry, Nina, of course.
I also will say 10 from the scale, and I would advise that people from all levels of organizations to participate in this process. Management of the organization, administrative staff, and also practitioners. And because each of them has different knowledge and skills, and can contribute to this process in different way. I think it is very important.
Thank you. And Rory?
I'm ultimately 10, but I think I agree with Dean. There is something about applying when you're ready. And I'm not, because the organizations that I assessed, this doesn't apply to them, but very, very young organizations, very new organizations who I think, and I think Nina and Svetla certainly have confirmed this, but I think the process is about moving to better practice, but it's also about affirming what you're already doing. And I think the balance could be wrong if people's practice if the practice isn't there at all to be putting themselves forward for there are other ways of learning from projects than applying for a full accreditation process that you're going to really struggle to get through. So I think it's a fantastic thing, and certainly I would recommend that all projects should be aiming for accreditation. But I think just a little bit of caution for projects who are just struggling every day with resources, struggling every day with keeping staff. If the practice if there isn't an underlying strength to the practice already, then I think the accreditation process could potentially be disheartening rather than encouraging. So a slightly more cautious answer, but no, ultimately, certainly, I think all projects should be aiming to do it.
Thank you. And I think just to pick up on this, because I think it's a very important point, and maybe some of you, I'm going to just anticipate, might have the question, well, how do we know if we're ready? Because we've been talking about readiness. And if you're not sure and in the future you would be interested in applying for an accreditation, please reach out to us. We really do have a very individual approach. I will ask Dura in a minute to put my email in the chat, and they're also obviously available on our website, all our addresses, and we can really have an individual conversation on what the situation is of your organization, what it would mean, and I think, I hope that it's been the experience of the organizations who piloted this process this year that we try to really look at the specific context and have an individual conversation with everyone to see where they're at. And we also have a self-assessment tool if you really want to look at your own practice and go through a questionnaire that helps you to check how you adhere to the standards right now. So that was our questions for the panel. Thank you all so much for making the time. And I'm going to now ask the audience if you have any questions. And please feel free to either unmute yourself and just ask, or put your question in the chat. Okay, for now, everyone's being quiet. So I'm going to just, I wanted to touch on a question that was put in one of the registration forms, where we also leave some space for questions. And some of you were asking about the requirements for the accreditation, and what would they be. I think we've kind of covered that and answered it, but I just want to give a straightforward answer as well, that basically the requirements are the standards. So everything now is based on this document that we have and that's leading all our practices. So if you're curious about what would be the requirements that you would have to achieve, then you should refer to the standards, and they're very specific on each point, and each point is elaborated on what that would mean, and what we mean by each point is quite elaborated on. And then if you further have any questions, of course, please reach out. Okay, I'm going to check one more time if there's any questions from the audience.
Hi, I have a question. It's Kate Jeffries. Now, I'm actually coming from southern area, so Western Australia. And I was really interested when I saw this come up in regards to the accreditation process. We currently don't have accreditation. And for Western Australia, we don't have many perpetrator interventions or men's behaviour change programs. There's only a few providers providing that right across Western Australia. So we're currently looking, one, at updating our standards, but also a registration and potentially moving towards an accreditation process. So I'll be really interested to find out for you all in Europe, how has accreditation, has that rolled out in line with funding? Has it restricted funding if you're not working towards the accreditation process, or have you put some parameters in place so that funders can't go down that avenue?
So on a European level, there is currently no European accreditation. This will be the first European-wide one. So in this sense, it's right now not tied to funding for programs, because we're still working on it, and it will also very much depend on national levels and how it's implemented on national level. There is specific countries where there is an existing accreditation system, and I will just take this opportunity to say that we're really intending this European accreditation to work in tandem with country-specific accreditation. So it's not supposed to overrule it or disrupt it in any way. This is really to support countries where there is no accreditation, and if there is one, to hopefully align with it and work with it. I will open it up also to the rest of the panel if you have experience on a national level of how accreditation and funding is tied in your country. Rory, maybe it's in Scotland, it's relevant.
Yeah, in Scotland, we're in a very fortunate position in that government funding we're fundamentally court mandated program for men with integrated women service, and the Scottish Government has set up an accreditation system, not specifically around intimate partner violence, but around any programs that they're going to fund. So our funding, that was a very robust, really hard work project to get that accredited, and so our funding, which is secure, is only secure because we have gone through that accreditation. So in answer to your question, that's very directly linked to funding in Scotland. In the UK, generally, Respect has a very well-established accreditation system, mostly for non-court mandated programs. And we've also one of the projects I was involved in has also gone through that process, so I understand how that process works as well. And I would say it's a less direct link. If you are accredited by Respect, it gives you much more weight in your argument with potential funders. So it's not a direct. If you get accredited, you'll get funding. But for non-statutory, non-court mandated work, where funding is generally harder to come by, the accreditation system is a tool in your attempts to get funding.
Thank you.
Dean, I saw you unmute yourself.
And we hope that the European one will bring that benefit, at least, even if it's not directly linked to funding, that it will bring that benefit to individual projects who are arguing for funding within their own countries.
Yes, absolutely.
Yeah, I just want to add an example. Here in Croatia, we have accredited programs by the Ministry of Justice, who is funding the court-mandated perpetrator work. So this is very straightforward. You cannot really get funded unless you are accredited.
So different models, but thank you for asking. It's a very relevant question. And as Rory said, we definitely hope for the European accreditation. Let's see how it shakes out in a straightforward connection to funding on different levels, also on a European level. But we definitely hope that it will be a good advocacy tool in so many ways for organizations, but definitely also in the funding conversation and in securing, hopefully, long-term stable funding, which we know is incredibly important and often difficult to come by for projects. Okay, everyone, we're over time now, a little bit, 1 minute. We kept you 1 minute longer. Thank you all so much for attending, and thank you to all our panelists for joining us and sharing their experience. Dure will put in the chat an evaluation form, so please take a minute and let us know what your thoughts were on this webinar, and have an amazing day. Thank you.